welcome. Thank you, everyone, for joining on this afternoon, no matter where you are, from Alabama to Kentucky to New Jersey to right here in Syracuse. We welcome you, and we're so happy that you chose to join and spend the next few minutes with us. And so we are so excited. We have gotten a lot of questions and a lot of feedback regarding our topic today, which is maternal mental health. So it's really exciting to see everyone joined and interested. And we have a powerhouse panel for you all today. And we're so excited to share just a glimpse of what we know. And hopefully, we're able to be helpful. So continue to go ahead and introduce yourself in the chat. Tell us where you're at, and we're going to go ahead and get started. So I'm going to turn it over to Denise Welch, who is representing Black Health, and she's going to tell you a little bit about Black Health and kind of how we got here today.
Good afternoon. Thank you so much, Rachel. And again, we want to extend a hearty welcome and thank you all so much for joining us. My name is Denise Welch, and I am the Associate Program Manager for Black Health, and I'm up here in Syracuse, New York. We are a national organization with our home headquarters located out of New York City. And we are so delighted today to have some of our guests, therapists and panelists on with us today. Just wanted to give you a little bit about who we are and kind of what we do at Black Health. We're formerly known as the National Black Leadership Commission on AIDS. In 2019, we rebranded after doing some work and seeing that there were other health disparities besides and in conjunction with HIV, AIDS, and hepatitis C. And so we rebranded in 2019. And so now we are now under the leadership of Black Health, the National Black Leadership Commission on Health. And so our mission now is to champion promotion of health and prevention and to reduce disparities and to achieve equity within our Black communities. Our mission is to reduce disparities and achieve equity to promote the health and well-being of Black communities through advocacy, policy, and action. And some of the health areas that we now cover are now breast cancer, cardiovascular, diabetes, sickle cell, prostate cancer, mental health, hepatitis C, and of course, we still encompass HIV and AIDS as well. And of course, since the onset of the pandemic, COVID has certainly been one of our disparities, which we have embraced and will continue to work with as well. And so as we prepare today to hear from our guests, of course, around one of our focus areas, which is our mental health, and this being Maternal Mental Health Wellness Week, we certainly want to embrace, ask questions, and to really just take advantage of this opportunity. And so our moderator and our facilitator today will be Rachel Johnson, who's one of our Syracuse locals here, who we certainly worked with on behalf of her Half Hood, Half Holistic coalition there, which she's the founder and the CEO. So I certainly want to thank her as well and to welcome Rachel, to welcome the rest of our guests.
Awesome. Thank you so much, Denise, and to Black Health for all the work that they do in our communities. Again, Black Health is a national organization with many affiliate cities. So thank you so much. I'm going to introduce myself, and then I'm going to talk a little bit about the background, why we're here, and then we're going to introduce the very long bios, like the very long resumes of our esteemed panel, and then we're going to hear from them because that's what we came to do. So my name is Rachel Johnson, and my background is largely in mental health. I also practice as a doula, and I do consulting work around diversity, equity, and community-based care. And I do own a business called Half Hood, Half Holistic, and Half Hood, Half Holistic and Black Health has been in partnership for the last several months to increase access to community-based care, specifically mental health care. And so it felt very much aligned with my passions to take my reproductive wellness hat and my mental health hat to create and help facilitate this session specifically. And if you know anything about holistic, you can't really like piece them out. They are so intertwined. So here we are talking about maternal mental health, and so not enough conversation happening, but hopefully this is one of many. So that is who I am. I'm so excited to see you all today. Or really, I can't see y'all. So excited to know that y'all are here. I can feel your energy. This year makes the 50-year anniversary of Black Maternal Mental Health Week. Excuse me, Black Maternal Health Week. It's a campaign and it's founded and led by the Black Mamas Matter Alliance. And it's a week of awareness, activism, and community building. And the goal is to deepen the national conversation about Black maternal health in the United States, amplify community driven policy, research, and care solutions, center the voices of Black mamas, women, family, and stakeholders, provide a national platform for Black led entities and efforts on maternal health, birth, and reproductive justice, and to enhance community organization on Black maternal health. So I encourage everyone to check out Black Mamas Matters Alliance and the series of events that they may having going on this week, but we felt like it made sense for us to do this panel on Black Maternal Health Week. So there's just a little background about that. And then for your agenda for today. Today we're going to talk a little bit about maternal mental health, and we are going to demystify some myths. We're going to get to know specifically about what our panelists have to say about maternal health. And we also heard from you all. So when you all registered to be in this space, there were so many questions, which is a good thing. That means that A, we have a product that you want or need, but B, it also means that you all are asking questions so that you can get the information. So hopefully we're able to cover some of your questions here today. And will not be able to get to all of them, but we tried to highlight and pick through the ones that we felt like would be more encompassing to everyone. And then we will be sure to make sure that you have answers to your questions in a later session. Okay. And without further ado, I'm going to lead into introducing our esteemed panelists. Our first panelist on today, you can wave, is Keturah Cochren-Albright. Say hey. Keturah is a social worker, marriage and family therapist, early childhood educator, certified doula, and certified lactation counselor. Keturah is a Syracuse native up here in Syracuse, New York. She graduated from Henniger High School, home of the Black Knights. Keturah went on to earn her associate's degree from Onondaga Community College in Humanities and Social Science. She also holds a bachelor's degree in Community and Human Science from Empire College. She also holds a dual degree in social work and marriage and family therapy. Today, she is completing her PhD in marriage and family therapy at Syracuse University. Keturah is passionate about all things related to the health and well being of Black, Indigenous people of color within systems. As a social justice worker, she spends a significant amount of time identifying and supporting initiatives that focus on Black perinatal and mental health and maternal health. She enjoys partnering with her sister and offering doula services and other women of color in the communities to support birth and lactation in the city of Syracuse. She enjoys spending time with her life partner and best friend, Julius Tyrone, and the children, bringing her the greatest joy. The love and support she receives from her family helps her go out each day, rejuvenated to do the work, and when she leaves, know that she is counting down every second until they are reunited. Unless, of course, she's on a beach somewhere. So, welcome, Keturah. Thank you so much. And I just love that you added pieces into your bio that humanize the experience because, of course, we are more than the work that we do. And so, thank you so much for bringing all of your resume and your wealth of knowledge to this space. Welcome, Keturah. Awesome. Our next panelist is Dr. Ashanda St. John. You're gonna you can wave. Awesome. Um, so Dr. Ashanda is the graduate of Sophie Davis School of Biometric Education in Cooney Medical School. She later received her doctorate in medicine from the New York Medical College. She completed her residency training at Danbury Hospital / Yale New Haven, affiliated in Danbury, Connecticut. She is a board certified OBGYN, physician with a wealth of experience in New York City, and focused on the delivery of quality care to underrepresented minority women. Her life's work has been devoted to the excellence in healthcare delivery via patient centered comprehensive care, which is inclusive of mental health and well being. She is committed to women's health issues and, most importantly, focusing on racial disparities, health equity and inclusion, maternal health safety, maternal health policy, and access. The role of telemedicine platform in maternal health and teen pregnancy. Dr. Ashanda is the chair of obstetrics and gynecology at the Health Alliance Hospitals, part of the Westchester Medical System Health Network, and faculty member in the Department of the OBGYN at New York Medical College. She previously worked at Columbia University Medical Center for 14 years, where she was the director of outpatient OBGYN services for the Ambulatory Care Network. She is a champion for patient advocacy, midwifery, and doula care, breastfeeding / lactation awareness, diversity, equity, and inclusion. Thank you so much, Dr. Ashanda. Welcome to our space. Yes, wow, congrats. Yes, these people have me talking, okay? Because their rap sheet, and this is just the bio, right? So thank you so much, Dr. Ashanda, for spending time and bringing your expertise to this space. We can't wait to hear what you have to say. Thank you. And finally, our last but certainly not least panelist is Marsha Jones. Wave to the people, Marsha. Hi, Marsha. Marsha Jones is a Texas native, a co founder and executive director of the Afiya Center. Please correct me if that is not correct. Afiya, there we go. Awesome. She holds a bachelor's degree in psychology and is a graduate of the Black AIDS Institute's African American HIV University and theology school. Marsha has served on various boards and capacities as an act of service in honor of Black women, a national grassroots organizer, community mobilizer, professional speaker, and health educator with a commitment to transforming women's and girls' lives. She pledged to the development of leadership and engagement of activism among women by challenging harmful systemic and political constructs to advance the economic, health, and safety of women and girls. Thank you so much for all the work that you do, Marsha, and we're so happy to have you. You all may be wondering, wow, we could have just read their bios. But no, we need to be able to give voice to it. Y'all wasn't going to read their bios, so I was going to say it because I want to give flowers while we can. So thank you all to our panelists and all the work that you continue to do. And we are so excited to go ahead and get started. So it's time for you all to speak. Tell me a little bit about, and anyone can take this question for sure. Why are we focusing on maternal mental health? Why not just mental health, right? Why not a panel that's specific to mental health? What is it about maternal mental health that deserves a platform and a space all to its own? I can start with Keturah, and then if Ashanda and Marsha have anything else, you all can jump in.
So my response, first of all, would be, why not? Black women are not acknowledged or represented in spaces as we should be, so why not? But most importantly, addressing maternal health and mental health. We have the lowest birth outcomes, health. We have the highest disparities in birth outcomes. And so being mindful of how that plays into mental health and the services that are not given to women of color or accessible to women of color. And so I think we need to shine a light, as we have been these last couple of years, on those needs and putting attention and resources to making changes.
Awesome. Thank you. So it would be nice if I unmuted myself. Awesome. Thank you so much, Keturah, for your response. Marsha, did you have anything to add?
Yeah, I just wanted to just kind of throw in there that there is such a detachment of our mental health and our physical health, our mental health and our spiritual health. And if we're not taking care of all of that at the same time, we can't ever possibly look to be physically healthy. So I think that this is really important, that we are highlighting this at the same time, because we can't separate our mental and our physical. And this is especially so with Black women, with the history that we have and the trauma that we're living in, that just exacerbates anything that's going on with us. That mental is just going to kick in. So, and just the stigma and shame and all of that stuff, I think that, and that ties into our mental wellness, that it should be talked about together all the time, not just this month.
That is so important. Thank you so much. And that's a good idea, right? Like, so we often like to silo things, and what we see is that if I can just focus on this thing over here, then I don't have to focus on this thing over here. And then what your body is going to do is say, "Hey, you're not listening to your mental health." And your mental health is going to say, "Hey, you're not listening to your body." So, thank you so much. Ashanda, tell me a little bit about why maternal mental health and not just specifically mental health overall.
No, absolutely. I think it's important that we start from the beginning and we talk about the numbers. And we know that right now there are such racial disparities in Black maternal healthcare that it actually is a public health crisis. We know that Black women are 3 to 4 more times likely to die in childbirth than their white counterparts. And this is nationwide. But if we look at New York, right? New York State, Black women are 5 to 6 more times likely to die in childbirth. But if we look at New York City, the number is as high as 9.4 times as high probability to die in childbirth. So when we look at that and we look at what impacts Black mothers, Black women or Black birthing mothers are actually 40% likely to have a maternal mental health condition. And when we look at those maternal mental health conditions, most commonly it's anxiety and depression. And if we look at those things, they're treatable and they're preventable. So this is why this is taking a spotlight, a platform, because this is something we can treat. And again, like Marsha said, there's sometimes a stigma involved in it. And so sometimes we don't screen for it enough in their medical appointments. There's not enough attention placed on the patients. And again, I think that it's terribly unfortunate that in 2022, I still have Black women that come to me and think they're going to die in their childbirth experience. So again, this is something where we need to shout from the rooftops, because again, we are in 2022 and Black women are dying in childbirth. And we have an assortment of reasons why, right? But one of those is systemic racism, discriminatory practices. And so when we think about mental health conditions, when we know that they're treatable, they're preventable, there are screening tools to screen for it, we can address the needs of our patients in a holistic manner. So not just treating their medical condition, but also their mental concerns and their mental condition. We know that Black mothers are twice more likely to have mental health conditions during their birthing experience, but only half as likely to seek attention for it or get treatment. So again, this is another public health crisis that we need to address. And I think we have to put a lens to. And so I think this is why we need to have weeks like this. So there's a spotlight. So Black birthing people can feel supported, and that there are opportunities that their mental health can be highlighted so that there is an impactful way to combat these issues that face our communities.
Okay, all right. And the panel is over because Ashanda just took us through it. Okay, thank you so much. I really appreciate that. I will also add one thing. I go ahead and engage in the conversation in the chat. And so thank you so much to Terry Hargrave. One of the things that was mentioned is that mother's mental health in the perinatal period determines so much of the next generation, right? And so also being aware that the maternal mental health of one person has not only a large impact on the child and or the immediate partner, but on all of the systems around us. And I will also argue that you will catch people in maternal health care that you may not be catching in mental health care, and vice versa. And so being able to focus specifically on maternal mental health, and it's a little different because our bodies are doing a little different things when we're talking about maternal health. And so it is really important to bring this to the forefront and let it have its time in the spotlight, because so often, especially when you get pregnant, the focus is really largely on your physical well being. What are you eating? Are you drinking enough? You got to take this medication, hold the baby, hold it's very, very physical. And we will talk a little bit about how we see maternal mental health in such a specific time, usually postpartum. So awesome. Well, go ahead and engage in the chat. Say, tell me a little bit about what the weather is doing outside in your area on the window. We're going to lead into our next question. So, this one is really interesting because each of you have a different background. Not only are you physically located differently, right? Geographically, you might be seeing different things, but also you all engage with the work very differently. So, tell me a little bit about some of the myths you want to dispel regarding maternal mental health. So, what are the things that you see in your practice that you come into contact with that may be something that is like grinds my gears when people say or think X, Y, and Z? And Marsha, if you're okay, we can start with you.
Sure. I mean, I think that's a good spot to start with me because I'm not practicing. I don't practice this in this way. I'm a grassroots organizer and just literally having to folk on the ground. But one of the things that I want us to know that happens is that the feelings that folk are having when they're pregnant happens when they start when they're pregnant and end when the pregnancy is over. Totally dismissing that mental health don't just start when you're pregnant, may be exacerbated by some of the stressors of being pregnant, but that is not where it starts. And that's just too dismissive. That's just something that's happening because you're pregnant. You will get over it. If we started mental health, if we introduce mental health, when we introduce health, period, from day one when folk are born, or sometime after, then it would be just a normal thing. So that's a really big thing that I hear a lot, that folks should just, you're going to be okay as soon, and then things happen after the baby is born. Things that, and I guess it should still go into that, some of the thoughts that you are thinking, even if they are thoughts that may cause you to harm yourself or want to harm yourself. Oh, that's just the baby. The baby is requiring more of you right now. The baby is trying to get out right now. The baby is trying to do this. And so the baby have you thinking that, when folk can literally be, showing some schizophrenic, some things around schizophrenia or whatever. We don't know, but we attribute it to just being pregnant. That's just a pregnant thing. Feelings of being fearful of stuff, like all of the things that people who are dealing with serious mental health issues are dealing with, and perhaps maybe this person never thought about it or never given it any thought until they got pregnant, or they went into pregnancy expecting it, so they didn't think that it was anything off. So I think, to me, it is all these little, like, we look at them as little things that happen. I think that this is a good time. And I saw that question and I was really excited that I was going to be on here with practitioners, because a lot of times practitioners don't get a chance to say this, and people that need to hear it don't get a chance to hear it because we're not talking to them. And so hearing practitioners be able to say, no, that is not normal. You should not be feeling those things just because you are pregnant. You may feel them while you're pregnant, but just because you're pregnant, which means that these things can be overlooked after a person gives birth. But yeah, so I think some of those things, and then right slightly after pregnancy, oh, expect to be feeling down, or because that's not a thing, and we just totally dismiss postpartum depression, which is a thing. And so people will things can happen because it's like, oh, I will get over it after the baby is born, because that's just a thing. It happens to all of us girls. I did it and I'm here. So I think, yeah, those are some of the things that I can think about. But I would really like to hear more on perhaps what the practitioners are hearing, because I do hear it. And those are the things that happen, that we hear, and we need to bust those myths.
Yes, we do. Absolutely. Thank you so much. And one of the things that you talked about is, the consequences of myths, right? And so, and part of that is if I think it just happens during pregnancy, then whose responsibility is it to address that, right? And so it starts to, and we will talk a little bit about whose responses, how communities need to be responding, how partners need to be responding, how families need to be responding. It's not just up to the prenatal appointment, whoever your practitioner is for your prenatal appointment, or whoever might be interfacing with you during pregnancy. So thank you so much for that, and we can get more into that. So, Keturah, tell us a little bit about a myth that you are seeing that's coming up for you that you wish to dispel, either in lactation work, doula work, or even in mental health work.
Um, Thank you, Marsha. Marsha listed a majority of them. So you're still out there. You're still connected, Marsha. That's those myths are still out there. Some of the other ones are, I hear patients or clients say that they don't believe that it must not be that bad because nobody else said anything. And so trying to help patients and clients understand that it's not the responsibility of anyone to acknowledge or identify change that happens, because you're going to be the first one. By the time someone else sees it, maybe your partner, but outside of your partner, those that are not in your immediate circle, it's gone pretty bad. And so by then you are needing immediate support. And so it is important that you acknowledge what's happening to you and share that, so that you can get support. This does not mean that the only time that you should address your mental health and physical health is because you need a serious intervention like medication or a procedure or some type of surgery. There are other things that can be done. I know we'll talk about it soon, that can address those things. Another myth, a big one for me, is in our culture, we got to pray it away. Prayer is a piece of that, but right, we're talking about the holistic frame. So the prayer you do pray, if you have a spiritual background, you provide that support to yourself, but then there's another piece in which you have to be active. You have to participate in a way. It's not enough to just pray. You have to activate it through your actions. And so dispelling that, and also being mindful that, we have individuals in our church systems who provide certain levels of support, but are limited of their understanding of behavioral health and mental health, and making sure that you're seeking supports from the right sources and persons.
Yes, thank you so much. And even going along with, our religious and spiritual leaders are also don't have capacity, right? And so also are very much saying help, help, help. And so thank you so much. And one of the things that you spoke to earlier was people feeling as if they this is a thing in our like that we don't know our own bodies, right? Or are not unable to say, hey, that's off. But when the narrative is, oh, you'll get over it, or it's just baby blues, you have this confliction where you're like, well, I kind of know something's off, but if I just chop it up and say it must be a pregnancy thing, then it has the potential to develop and continue, and then it gets bigger and bigger and bigger. And as you stated, by the time other people have the ability to notice, that means it's translated into behaviors, right? And that means that it's just a little, we have to take a little bit more time to slow down and say, okay, what's going on? And so I think what I heard you say is that you are very much the expert of your own body, and you know what your baseline is mentally and physically, right? And so we come up into this just around being able to say no to your provider or to your partner or to your stepmama, whoever. No, this is a little different. It's something is not, I don't, you're telling me what my experience is, but I'm telling you what my actual experience is. And so empowering people to say, hey, I think that I would like to look into this a little bit more. Awesome. Thank you. And then Dr. Ashanda, tell me a little bit about some of the myths that you see in your practice.
Well, I think that certainly there is the fear of judgment and the stigma that's around mental health conditions. And so sometimes our patients feel that if they disclose they have a mental health condition, or if they start to experience symptoms of one, that maybe someone will call ACS or Child Protective Services, or maybe their child will be separated, or maybe they'll write something in the chart where everyone will see. And so that is kind of a very large one. I think also we have patients who are on medication before they get pregnant, who are fearful that the medication may cause some harm to the unborn infant. And so then they may choose to stop it without discussing that with their providers, whether it's their mental health provider or their obstetrician or their OB provider. I think that is another myth that you see. I think that also there is self-medication. And so some patients feel that they self-medicate with, could be marijuana or whatever, and that will help them resolve it. And so I think that, having an approach where we elevate patient-centered care, and so that there is judgment-free care, respectful care, and care that is offered and given without stigma, then perhaps our patients can be more free of thought and confide in what is actually going on. Because I think that we all know our bodies the best. But again, there are certain things that we keep kind of to the side because we are fearful what anyone may think of us. And so when we think about mental health conditions, right, there is such an impact, not only on the patient, on the baby, on the family, but there's also generational stress, and there's intergenerational toxic stress that can be passed down from generation to generation. And so when we think about this, we have to open up the conversation so that there is no judgment surrounding it. And we understand that there are certain things that we can prevent. So we know that depression and anxiety can increase your risk of preterm birth. And we know that's a big thing in our communities. And so again, getting treated for that can also kind of prevent us from preterm birth. And so again, I want to say this over and over, there are so many conditions that are treatable and preventable. And so we have to listen to our patients, and we have to make sure our patients' voices are elevated and amplified.
Thank you so much. Elevated and amplify. I love that. And one of the things that is really important is being able to know that like you said, treating your mental health will maybe help to alleviate some physical health things because they're connected, right? And that being able to say one of the right when we talk about chronic diseases and or disorders in communities, the biggest thing is stress, right? Like stress. Like the higher stress levels, the more you're at risk. That is true for pregnancy. For some reason, people struggle to see stress as a mental health thing, right? There's like some sort of a connection there. And so, but we often say lower your stress levels, just manage your stress level. What does that mean? Like, what does that even look like? Like, how am I supposed to do that? And if I'm partaking, if I don't even call something stress. So you talked about generational traumas, you talked community-based traumas, all of these things that I may not even be attributing from my vantage point, is stress. It just is. Just a matter of fact. It is a thing that I come in contact with. And so, how do I then manage that? So, thank you so much for talking about. So, we're going to get into some specifics in just a second of how, like, now we have a good understanding of the what. We want to get into the how. One of the other things that I think is important to note is that when we think maternal mental health, we often think postpartum depression, right? We think one specific period and one specific disorder, right? And so then there's a lot of focus on postpartum depression and solely postpartum depression. Maternal mental health, A, is a range. It is a spectrum. A, maternal means the time of conception all the way, and thereafter. You are like your mom, right? And so when we think about maternal mental health, not only should we think of it as a long-standing thing, we should also think mental health is a spectrum, right? There are many things that come into play when we talk about mental health. And so one of the things that has been coined more recently is this a concept or this idea of perinatal mood and anxiety disorders. Because what we often had was one screening tool and one diagnosis. Postpartum depression screened by the Edinburgh, right? And so those were the two things. And so if you're experiencing anything outside of that, so if your mental health challenges happen early on in pregnancy, or if the onset of mental health challenges didn't come until 6 months after you had a baby, then those things were not encompassed. And so it also leads to being able to say, this must not be a thing because it's not postpartum depression. It happened earlier or later than people told me it would. And I'm not depressed. I'm anxious. I'm scared. I'm paranoid. I'm maybe seeing things, or I am like having a loss of reality touch. Like I feel like my baby is here, but for some reason I don't feel connected to that baby, right? And so these are all other things that if I think, well, that's not depression and it didn't happen in postpartum, then that must not be applicable for me. And so, one of the things that we have to be able to understand about maternal mental health is that it is a spectrum. There is a spectrum and a range of things that you can experience, and it can happen. In this case, for mental health, everyone has mental health all the time. You either have good health mental health, poor mental health, you're managing mental health, etc., etc. However, maternal mental health is specific for people that are either carrying and or mothering. And so from the time that you have a conception all the way on to mothering, anything can be coined maternal mental health. So I think that is really important for our viewers and our participants to understand that if in fact you start to develop some anxiety before baby comes, that also is included in this spectrum of maternal mental health. Okay. I'm going to ask our participants, we're going to launch a poll. I'm going to look through the chat and see what you all are saying in the chat. But in the meantime, we're going to launch a poll. So I'm going to ask our participants that are here inside of the actual Zoom webinar to go ahead and utilize this poll. So number one is how comfortable, if you're live on Facebook, we have some Facebook friends. Hey y'all. If you're live on Facebook, go ahead and comment what you think your response is. So I will read them and I will read the options. How comfortable are you with discussing topics related to maternal mental health with your provider? Either very uncomfortable, uncomfortable, comfortable, or very comfortable. Okay, how comfortable are you with discussing topics related to maternal mental health with your provider? How often, number two is how often is maternal mental health discussed in your community? So think about where you are in proximity every day. How often is how often we have this conversation? Is this the only time you've had this conversation right here on this webinar? Let us know. Never, rarely, sometimes, always, or often. And the third question is, are you aware of how to access mental health resources within your community? So, do you know anything about how mental health in general? Do you know specifically how to get access to resources in your community? Do you know where to start? We have people from Kentucky, we have people in New Jersey, we have people in Syracuse. Where do you go? So the not at all aware, not so aware, somewhat aware, very aware, or extremely aware. Okay, awesome. And when we have a good amount of responses, the poll will close. I'll give it just a few minutes. Let's see what you guys are talking about in the chat. So Sunny Jones says, and if a doctor can't bill for it, questions won't be asked. So that is we will talk a little bit about some of the barriers or limitations to care. And a lot of it is systemic, right? So what are the systems that, like, how is the system equipped to ask questions about maternal health? And then if they do we have the capacity to hold it? Um, Yes. Awesome, awesome, awesome. Yes. Patricia Albright says, yes, pray is part, but not the whole. We're talking holistic, y'all. So I appreciate that. And then Athena is sharing a personal story in the chat. And so we will get to that because there's a question inside of there, okay? Awesome. All right, so we are going to keep the poll open until we get our goal of 70%. So if you have not done the poll, please do so. And while you all are doing the poll, I will read Athena's question. After my difficult pregnancy, my doctor tried to put me on medications after birth that you disagreed with. The provider said she said that I was an asthmatic when I wasn't having any issues with breathing. When you refused the meds, or when Athena refused the meds, she yelled at me and said she went to school to be a doctor, not me, and kicked me out of her office. She was Indian, and I believe the situation was racist. It caused a trauma. What should a person do in this case? So this is pretty loaded. So I don't know, is there a panelist that wants to speak to what options, if in fact this is an experience that people are experiencing? So first, if in fact I'm trying to advocate for myself and my provider may not be listening and or has asserted authority, what might I do in that specific? If I'm trying to advocate for myself and my provider says it blows me off, what are our options? What can I do? Dr. Ashanda, can you take that one?
Sure. I mean, I think it's very difficult. I always really afford my patients and encourage them to select their team, select their doctors. And sometimes it's maybe interviewing them before you even accept them to be part of your medical journey or your birthing journey, because I think that's important. I think there has to be a bond there and an understanding. And I think this is also the reason why we know, and this is actually proven, that there was a study done for babies that were in the NICU, and they did better, Black babies, if they had a Black provider. And so we also are seeing that as well in obstetric care, is that, and I have a lot of patients who actually travel quite a distance to come see me because I'm a Black woman, and I understand, or I may be able to empathize better the struggles that they may have experienced or experienced now. I mean, I think in this case, I think there are opportunities for you to advocate for yourself, especially when you're inpatient, by getting a supervisor or the attending physician, or even going as high as patient relations, or even the administrator on call. There has to be an empowerment of our patients to self-advocate. And what is described in this situation is disrespectful and unacceptable. And again, this is what has caused birthing trauma, which then can be another form of PTSD. And so as opposed to thinking back on what should have been the best day of her life, it sounds like she was utterly disrespected by her medical provider, which is unacceptable. And I think that even though this situation may have passed, there's opportunity to file a complaint, because hospital systems have to do better. Patients are there to receive help, which is respectful and non-judgmental, and that's what they should receive.
So I wanted to just throw one thing in there that I haven't like heard us talk about today, and we're really giving out a lot of really great information. But when I think about the folk that I get to hang out with at the Afiya Center, like a lot of this stuff people don't even know, like people don't even know that they can advocate inside of a doctor's office. That's like such an uneven power dynamic there. And so folks don't even realize that that's a thing. People don't even understand that they can get the birth of their choice. And then we talk about the birth of their choice. We don't even know what the birth of their choice is. If you've been going to a hospital or a county hospital, whatever, all your life, then what does that mean? So I think back, this is addressing Athena's question. One of the best things that can happen is being connected to community-based organizations, right? Who's on the ground working with folk, and a doula. Not this, like lifting up how important a doula is, because if you're being doulaed and you have a doula and that doula is still with you after birth, then like you can quickly talk to your doula and say, even if your doula didn't go to your appointment with you, especially in times like now with COVID, a lot of doctors are still not allowing folk to come in, then that person can holler at their doula and say, look, this just happened. Then you, as the person who just birthed, who already have enough on your plate, right, won't necessarily have to take on that right now upfront advocacy piece, because now you have someone who's going to advocate for you, who can then have that conversation with that person. But what we have to do a better job as community folk, what we have to do a better job as people who are serving people, is really talk about these things in the community, so that when people go, they know what a doula is. They know that they have someone that can advocate for them, with them, and while they're going through this, and that they know that there is even a thing called a birth of their choice, and what a birth of their choice even look like. So I just wanted to lift that up. Working with community-based organizations, making sure that we're doing really informed community education, so that folk know, because folk are automatically powered when they know that they have power.
Ooh, amen. There we go. I appreciate that so much, because um, sometimes, and when we talk about accessibility, right? What is probably more readily accessible? Being able to get a specific provider, or going into my local community-based care center or community center. Black Health does a lot of work around mobilizing health literacy and making sure people are connected. It's being equipped with the tools and the community before you have that conversation, because you're not, if you're gonna, you people start acting a little different when other people are in the room, right? You know what I'm saying? It's a community behind me, right? And so when you're, people, knowing that people have information and power, and knowledge is really powerful. So I always encourage people to research, right? And to do your own research. Yes, providers have an obligation to do informed decision making, right? To make sure that you have informed consent processes and tell you all of the things. But there is no better power than being informed on your own options and your own. So you even showing up here, right, is something that you should be proud of, and you showed up for yourself. Come equipped and come with questions. Interview people. Your relationship with your provider is just that, a relationship. And if that relationship doesn't serve you, baby, we got to find something else. Okay. All right. So we could talk about patient advocacy and empowerment all day, but let's get back a little bit into the structured questions. I see the chat is blowing up, so y'all are loving it. I really appreciate that. So our next question that we're going to head into is, what can partners/support systems do or need to know regarding maternal mental health? So what can partners or support systems do and or need to know about maternal mental health? Because right now we focused a lot on like the person, the individual. So let's talk about that person's support system, and what they can do, and then we'll talk a little bit about how our community can engage with that as well. So Keturah, we haven't heard from you a little bit, so tell me a little bit about what partners can do or need to know.
So, we enter into relationships, and sometimes these children are planned and sometimes they're not, right? And so depending on how that comes about, how you partner with the father of the baby may give a different outlook on how you share your history with that person, right? And so it is not always a case where we get to have an opportunity to share the history, create a plan, and then, follow all these beautiful steps. But if you acknowledge that this person, you and this person acknowledge that you're going to be in relationship together and supporting this person has identified that they're sticking around, they're going to support you, then it is of utter importance that you give them a full understanding of who you are, what your history is before they came into the picture. One of the things that I was thinking of before you took the poll, Rachel, was the idea that a lot of times we're not acknowledging women's fertility or maternal experiences until they're a certain age. So if she's not 18, then she's not really a woman yet. So we don't acknowledge that. And so we might not acknowledge those births or losses, abortions or miscarriages that may have taken place before then. And again, because she's younger, we might not identify that she needs support. So what does partnering look like for a 16-year-old woman? How do we support her? No different than we support the 35-year-old. We want to make sure that everybody that is in the picture is informed around what experiences this person has had before pregnancy, right? And that it relates to her maternal health and her mental health and what supports are needed right now. Can your partner advocate for you? Does your partner have an understanding of what your needs are, what your wants are, right? And so even then, if that person cannot, we don't push that person out of the picture, but then we resource, find out who can we bring into the picture that might be helpful. Okay, maybe the partner and your mom don't get along, but who else can we get the auntie in here? Can she help? Can she give understanding and support? She has an understanding of your anxiety from when you were 10 years old and maybe you were in that car accident. She understands how that played out for you along the way, as well as understanding what it may look like, if you're dealing with fertility issues and you have a partner that came into the picture 5 years into this issue, but now it's just new to them and what that might look like and, how they might be able to support. So I think it's important that we give our partners, those we look to go into parenting relationships with, even if we're not staying in a relationship, if we're parenting together, then give a full understanding of who we are, what our experiences are, as well as what we would like to see in this partnering relationship. And then aside from that the partner then also educate themselves on what it is that they need, what resources they need to have in their wheelhouse to support this person, and being mindful of their own limitations in that, and acknowledging their own mental health and what those implications are, right? And so I'll stop now. I guess somebody else will turn.
Thank you so much. I really do appreciate that. And I think that, they talk about premarital counseling. We need to be having pre-baby counseling. We need to be having counseling all through. Like, there are a lot of issues just in general with parenting and different values and beliefs. And we might, myself and my partner, we might be good right here. But baby, here come grandma. And here comes this person. So really being able to have and flex them boundaries, but being on the same page when we talk about partners. But also, right, this baby is not going to always consistently be with me or with you. And so what happens when we at grandma house and grandma house is doing something else? So I think that that's really important. But we need to start a pre-baby counseling group, okay? The question is, just to remind all of the people and myself, what can partners or support systems do or need to know regarding maternal mental health? So, Dr. Ashanda, and then we'll pass it to Marsha.
Well, I think it's really important. One of the things that we saw during COVID is the isolation of the patient. Partners weren't allowed to come into the hospitals. Some hospitals weren't allowed to attend prenatal visits or even ultrasound appointments. And so I think that understanding the importance of the partner and understanding that support structure and system that that patient needs for their mental wellness at the least, and also empowering our partners to care for our patients during this very special time. That is very important. Making sure that we include partners in birthing classes and in breastfeeding classes. But also, if they do have a doula, having them incorporated as well. I can tell you, when I came from New York City and went upstate, I had a patient who was going to have a scheduled C-section. Her baby was breech, and she was there with her spouse and her doula. And so before I arrived at the hospital, I guess there was a discussion with the nurses that the husband and the doula could not come inside the C-section room. And so when I got there, the doula said, well, I guess I'm just going to be here postpartum. And I said, why? I said, you have been with her entire birth journey. Why are you going to miss this birthing experience? And so, there was a lot of roar. And I had to let them know that we did have an executive order from the state that actually said that a patient can have a support person and their doula present at delivery. That didn't say what type of delivery. It didn't say if it was a C-section or a vaginal birth. And so I had to advocate to have that doula there. And this patient was so appreciative. And ultimately, it worked out because her husband passed out and had to leave the operating room. And so at least the patient still had someone there to support her. And so when we look at this, we have to be creative. Like, we can't say everything is black and white. There are several shades of gray that our patients need to support them. And that's what it is with mental health. We have to support the community. As we always said, it takes a village. And that village, we can't describe what exactly it is. That person knows what it is. So I think elevating the importance of the support system, of the partner, of the doula, that's what needs to happen if we want to really, truly have a patient-centered approach.
Thank you. I really appreciate that. And I was, just screaming at some of our, medical systems because they need to know and hear that. But I think that's really important. The other thing I wanted to really just quickly mention, Sunny had mentioned something about surveys. Y'all know how y'all get with surveys. But right, like y'all ain't even going. Y'all need to fill out the survey that they just put in the chat for this event. Okay, y'all know how y'all get with surveys, so make sure y'all open up that survey and do that. But the reasons why people push, and I'm not a survey girl either, but I've learned, right, that data tells the story, right? That the narrative is only being crafted by people that say or speak up. And that may not mean that I have the skills or it is even safe to do that right here, right now. But best believe somebody's going to hear what I have to say. So when we don't participate in things like surveys or data evaluation, that's a whole narrative that's being missed. So somebody else is telling that story, right? And so having empowering conversations with your community, with your social circles, with your partners, and being able to say, like, when I get into a space, it's patient led. However, I know we right here. So if in fact that, you ain't gonna be trying one, because I know we're right here with it. And so I think that's really important. But take the survey, but also be sure that your voice is heard in whatever way that makes sense for you, right? Because we might say, go inside there and tell them X, Y, and Z, right? But that might not work for me, right? That might, or like you want a person that's not confrontational, or white coat syndrome is a real thing, right? Feeling like I don't have the power or the authority to do that, and it may not be safe. Right? It just may not. I don't know what y'all about to do. Y'all got all of them little snips. If I start yelling at my doctor, I don't know what that. These are really real things, but still know that you're empowered and have options to do something, right? And that there's always something that can be done. And those are the community-based people that will say, no, we gon' sometimes I would, I worked in a community-based doula program for a little bit, and a client would have an unfavorable experience and not know where to report. I had to do the work to be able to say, this, I can't report on your behalf, but even understanding who and where I can go to was really important. And so know that you have power even if you are the partner, if you are the doula, if you are the daycare provider, you have power to be able to help and assist and support. And then go ahead, Marsha. Tell us a little bit about what partners or support systems can do or should know about maternal and mental health.
You know, it's literally been said, I guess for me, I would just like want to make sure that when we are talking about partners being like really expansive and what partners look like, and birthing teams and folk and villages look like, because it don't necessarily look, we know it don't look the same, but, being expansive in our conversation and expansive in preparing folk, because when we're having same gender folk, when we're having trans folk, come into that space, and especially I would say when we're having trans folk to come in that space, making sure that that partner understand, well, first of all, helping to survey or navigate what birthing space that's going to happen in, and understanding that let's start this as quickly as we possibly can, because it may be different birthing spaces that we're going to have to talk to, may even have to try some of those birthing spaces out, because while they may say that they have an expansive view, when you get there, it may not be that. So really doing the work with what partners look like, and working with that partner to understand some of the challenges that's going to be in front of them, outside of the challenges that we basically have with maybe you can't be in there, maybe you can, but maybe this person is not going to be, maybe they're not expansive enough yet. I'm not going to say they're not going to get there, but that birth center that you wanted so bad, because they were all Black folk and they were this and they were that, but they may not necessarily be ready yet, not yet, for a more expansive birthing experience. So I think that that's really important too, helping, I don't want to say non-traditional, but helping more expanded partners, making sure that that particular group, that we are all on the same page there, and not just talking about all the amazing stuff going to happen, but letting folk know that there may be some challenges in front of us, you know what I'm saying? And how we can navigate those challenges. So again, I go back to that early education and those early conversations that can be happening inside of our communities right now, that's letting folk know that these things are available and these things can happen. So I think just, yeah, that's the only thing I would add.
The only thing. So I'm gonna just add my little 2 cents. Okay, that was a whole dollar. Okay, I appreciate that, and I think the other thing that makes me think is about expansive family systems and dynamics. Because my partner might be grandma, my partner, my
Yeah.
doula might be auntie, right? My doula might be, and so being able to understand that, if I come in and I may not have what, like you said, the traditional or the view that of landscape of support. My support system may not be family. I may not attribute my support, all support ain't good support, right? And so my support system might be, I'm coming down to see Miss Marsha at the neighborhood community center down the street because that's my girl, right? And that's the person I'm connected to. So when I say support system, I want people to be empowered that anybody can be in a support system, right? That anybody can help at any point in time and at any point in touch point. Which brings me back to the conversation about mental health. You may not know how many touch points a person goes through every day, right? I talk about this in the framework of children. By the many touch points that a child has throughout a typical day is probably anywhere to 10 to 15 people. And you never know, if you, from the bus aide to the hall monitor, you may be able to notice something or catch something that not everyone else can catch. So the same thing is very applicable for maternal health, right? And so if I think only the partner and the doula have the power to say, hey, are you eating? Hey, I noticed that you haven't been getting much sleep. If I think that if I'm limited in my ability or my power as a support system, then I'm gonna stop asking certain questions, or I'm not gonna start in the first place, right? I may not start the conversation in the waiting room with you because I think that, oh, the doctor is gonna do the screening tool, so I don't really need to be asking questions about mental health. It is really important to know that anyone can be a support system, and if we just start to normalize conversations with people, period, we might get to a place where that person may not actually be saying, I'm having mental health challenges, but you can reflect, not your opinion, you can reflect, not your fake diagnosis, just your observation. Hey, I noticed that you taking really long showers, and I kind of heard some sniffles. Are you crying in the shower? Like, I noticed that you haven't really been eating much, and I know that you're saying that you're stressed out because of the baby, but it looks like it could be something else. Do you know? I noticed that you're really you get really really anxious, and you're pacing back and forth when you talk about the baby. Like, is there something, starting a anyone can start a conversation. And I think that that is so important to know. And I think Keturah talked about it briefly, is that partners and support systems, you all have your own mental health as well, right? And so feeling like, as a partner or support system, I have to put my stuff to the side to be able to be here for mom and baby, or birthing person and baby, does not mean, right, that I don't have my own experiences. I too am tired. I too get anxious. I too feel overwhelmed. And maybe even like feeling like, because I can't show that, because I need to be strong for this person, right? And so then how does that then play into our narrative about mental health? But if I can confront and understand my own mental health, I'm more likely to be able to support someone else, because I can say, man, this is hard. And then partner can say, yeah, it is hard. I haven't really been eating. Yeah, me neither. Oh man, we should probably get some support around that. Okay, so those are my 2, 3, 4, and 5 cents on that question. I appreciate everybody was sticking with us. I see y'all are holding steady. We're gonna make it through the rest of our questions. So one of the I'm probably gonna skip around, and I want to address some of the questions that you all submitted during your registration period. But while I'm doing that, don't forget to do that survey they put inside the chat. They're going to do it again. I know they are. Um, let's see. Let's see. Which one are we going to do? Okay, so let's talk about practical solutions. So the question is, what are practical suggestions we can offer to Black women during the pre and postpartum periods to give them encouragement? So what is something that we can do during pre and postpartum? What are some tangible things that we can offer? I will start with Miss Dula Keturah, and tell me a little bit about what are the things that maybe you do with your clients that help support them.
Um, I think one of the first things we come to understand is, don't expect so much from yourself. Your body is doing so much already. And so if we can just allow ourselves to just fall into that and relax into that, kind of brings that tension down a little bit. Also, the idea that, some of the things that moms talk about is this, this added weight. It's expected. It's a part of the process. If you're not gaining weight, we kind of want to address that, what's going on. And so normalizing activity in a healthy way. So we're not overexerting ourselves. We're not watching social media and the fitness guru who's doing all of this at 7 months. We're not doing what they do. We're doing what's normal, taking small walks outside. And if sometimes, like you said, normalizing, not expecting too much. So maybe the activity is just cooking or folding laundry or doing laundry. You don't even acknowledge like that added weight going up and down the stairs and folding clothes and vacuuming. That's a lot. So if you clean a room, kudos to you. You did that. Thinking about things that bring you peace, solace. What is that? I feel odd just sitting down. Well, if that brings you peace, do that. It doesn't have to look a certain way. It doesn't have to sound a certain way. It's what works for you. And when you're doing that, acknowledge your heart rate, your breathing. If you've noticed that it's still elevated, then what you're trying to do is not a good fit for you. You're still reactive. I'm finding something that brings your blood pressure down. You're able to ease into your breathing. You're calm. Finding those things that help to regulate your overall well-being. Also, I would probably say, connecting. It's important to stay connected. Sometimes you may feel overwhelmed by what you have going on, but it's important to stay connected in some meaningful ways to help balance yourself. You don't want to find yourself disconnecting and disassociating, right? But that you're staying connected to healthy resources and supports.
Mm. That's so good. And what I also heard is that it's okay to put yourself first, right? It is okay to, mommy needs me time, right? Person needs me time, right? Like it is 100% okay if you are not 1,000% obsessed with baby all the time. And that is okay, right? And I also think sometimes when we focus, sometimes when we talk about maternal mental health, we don't even get to that conversation because all of the attention gets placed on baby or child. And so sometimes y'all are deflecting. Like y'all are just, if you put all your energy here, I don't have to pay attention to what's going on here, right? My identity becomes this baby. Everything, like I'm a little concerned about that because when I go to my postpartum repress the appointments and I say, how's it going? And like, oh good, the baby's good. And I say, how is it going? And they're like, oh, it's good. How are you doing? I'm good. That's it. Like I'm fine. A little tired, but then you're like, you get into the deep thing. So, I also think even for support people and partners, being skilled and asking more than just the baby, right? To be able to say, how are you doing? So, thank you for that. So, practical suggestions for pre and postpartum support. Dr. Ashanda, and then we'll go to Marsha.
I think it's important to understand and recognize, especially with first time parents and first time mothers, we all fear the unknown.
Mm.
It's normal. We all fear what's happening to our bodies, the changes, what's happening with our hormones. I think it's also important to understand your journey is your journey. And so it may be different from others. We always have patients who, my mother says this, my grandmother says this, everyone is an expert. But we have to understand your journey is your journey. And so we want to empower our patients, again, giving them fruitful resources, allowing them the opportunity to ask questions. I actually encourage my patients to come with questions. And sometimes if they have more questions than we can answer, then we will table that or schedule a follow-up appointment a bit closer so we can address those questions. I think another thing that I do, which is a bit unique, is that I have created a skeleton birth plan, and I distribute that to my patients when they hit 35 weeks so that they can be empowered to construct the birthing experience that they want. And also giving them the tools to say, well, this is something that happens here, how would you like it? As much as we can do for our patients, because that empowerment kind of brings down the fear factor for them. And again, we have to think about how this is incorporated and intersects with maternal mental health, anxiety, and depression. Part of that is fear. And I think we all have it, and recognizing that, you are human and that there are ways that we can support you, and that I'm saying that as your medical team, as your providers. And sometimes we need to know what we're doing bad and what we can improve upon. Because again, this is elevating the patient and making sure that their voice is amplified. So I think there are tools that we can afford our patients that will empower them and also help them advocate for themselves.
That is so important. And I often hear people reference a birth plan, but one of the things that I like to do with my clients is a postpartum plan as well, right? And so we often focus really very much on the act of birth or act of labor and delivery, and then that is it. And so even when we think about perinatal, when we think about across pregnancy, you could really start to work with people on a pregnancy plan, and then a birth plan, and then a postpartum plan, and then a parenting plan, right? Because you're going to be able to address, right, all of those holes lists. And so some of that is financial, some of it is like, how are you going to take care of your body? Some of it is mental, like, what are you going to do when you feel like things are too much? Do you have a plan for that? Who are you going to call if in fact you become overwhelmed, or you start to have thoughts about harming yourself or the baby? Do we have a plan? Has anybody asked you these things? And so I think that, or your child, right? And so I think that it's really important to try to expand the tools that we offer people, or the conversations that we have. So thank you for that. And then Marsha, some practical suggestions on how we can support people pre and postpartum.
I literally was going to talk about a plan. I definitely believe in, if it's at all possible, having a plan. I'm old school. I believe it's better to have a plan and don't need it than need a plan and don't have it. So that's just literally where it was sitting on my mind, having that plan. Also, just always being there to affirm folk, and practicing harm reduction with folk, and I was just thinking about when you were speaking, Dr. Keturah, about the weight and things like that, and just, helping folk to understand that these things are expected and it's okay, and again, like I say, affirming and along with the plan, letting people know, kind of looking at the plan and having some go-tos, you know, um, breastfeeding lactation may be a challenge. So what can we do about that? I think we had like about 3 or 4 babies last week, like they was just like coming. And and even though the doulas have been working with mommy, but baby got here and lactation was just a challenge, and all of the plans that was in place, it was still a challenge. And so it was letting, I would help my moms to understand that, help to understand that even if everything is on the paper or you have that paper on the wall, a phone call, if you can get it, will still work. So it's just kind of like some of the little tiny practical things. And just, my last of this is one of the things that we've done at Southern Roots Doulas, that's powered by the Afiya Center, is that we've all kind of identified where our strengths are. So the mom also know, or the birthing folk know, that while you're that doula that you've been there with every step of the way, may not be the person that you get to call, but we're all there. And so I joke with them all the time and let them know I'm the pitch hitter, right? I'm probably not going to be the doula that's going to do all the hospital stuff and sit out there all day. But I am the doula that'll come in when your doula that you've had all the time can't be there. Or I am the doula I'm really good with self-care kind of stuff. So I'm on it, when you're panicking and you're not there. So letting the doulas know that, letting the babies know, or letting the moms know, if you have the opportunity to have a doula, and letting them know what all doulas is there, and how they can serve you. So we like to let our mommies or our birthing folk know that there's a whole team here that can serve you. You don't have to go outside of your circle. So we remind them of that.
Thank you so much. That is so important. And I think that I will offer some practical advice for medical providers or practitioners. We have a wide array of people with backgrounds on here. A, you're human first, right? And so never be above accountability ever, right? Sometimes we get into these spaces and we assume this role. We get the director of this, so we done went to all of these, prestigious places, but these people right here on right now are very well decorated and can say we all make mistakes. mistakes, right? Like we are not above accountability, and we need accountability in order to grow and expand, right? And so if you think you do everything perfect for your patients right now, I'm good. We're gonna have to have a conversation about that one. Like we're gonna have to. I'm not sure about that, right? So never be above accountability, and never think, right? Sometimes what we do is we be like, oh, the doula's gonna handle that, or the intake person's gonna handle that, or I'm sure that the receptionist covered this with them, or I'm sure we trust the system a little too much sometimes. And so then we miss it, right? We miss the opportunity to really go through and walk through. If the screening that we're doing, we're just rattling off questions, or we just gave it to them, we pushed it to them, then I don't know what this is. I'm not putting my name on this. You didn't tell me what it was or where it was gonna go. And never ever ever underestimate the potential of a relationship, right? And so instead of my relationship being provider client, can it be human to human? And can I humanize your experience? And can I start to create a warm environment where you feel like you can mention some of these things? So very often we get inside there and it's kind of sterile and rushed, and we're unable to really feel connected to you. Or if I go to a clinic that's community based and I see a different provider every time, that makes it really difficult for me to build relationships. And so, what is your practice? What are your values and beliefs when you practice as a provider, and how does that come out inside of your services? It also goes back to you as an individual or a family to ask those questions. Am I going to see a provider every time? Like, it's like I need to know that before I get here. Um, so one of the things that I want to, and I will just, the last few questions I will just direct at one person. So one of the things that I know that happens often on the other side are barriers and limitations. And so what are the things that providers experience that make it difficult to address Black maternal mental health or maternal mental health in general? Like, what are the there are some realities in the medical system that make it very difficult to give proper care the way that we imagine it. And so it's important to talk about funding and policy and systems, et cetera, et cetera. So this one is actually directed at Dr. Ashanda. I put you on the spot, but can you tell us a little bit about what are some of the limitations?
No, absolutely. I think that sometimes we don't know. Our patients don't confide in us. So, if we don't know, how do we address it? There are ways that we can implement kind of systems. So one of the things that we do at the hospital that I'm at is we do depression screening before you're discharged from the hospital. And my practice, we actually do depression screening at 3 times during the pregnancy at each trimester. And then what I do in my practice is all of my patients, whether they delivered vaginally or a cesarean birth, they all have a 1 week postpartum visit. And that's a postpartum wellness visit for us to foster and support and provide lactation support, blood pressure screening and depression screening, and also wound care. But it's also an opportunity for us to help our patients if they're having baby blues, which we know 80% of our patients have. And we know if that lasts more than 2 weeks, then we really need to look at that person for postpartum depression. So I think there are opportunities and creative solutions that you can certainly put into place that can help our patients. But sometimes our patients aren't forthcoming because there's stigma, there's judgment, or they feel that they're not being a good mother, or they really want to be able to handle it and they don't know how to seek out help and support. I had a patient recently who was losing weight, losing a lot of weight, and she was not eating. And I was so concerned, and she couldn't come in. So what we've learned with COVID is that we've been able to elevate medicine on a telemedicine platform. So we had telemedicine visits twice a week. And finally, she told me what was going on. She finally did not just check whatever box on the depression screen. And we were able to really concretely devise a plan that could help her. And once she got back to herself, she was so grateful. So I think we have to afford our patients grace. It's a lot that they're going through. Motherhood certainly is not easy. Childbirth is not easy. The whole pregnancy journey is not easy. But I would say specifically the barrier for me is sometimes when we have the depression screening in place, we see the patients and they tell us they're doing okay, but we know there's something else, or we see it, whether it's in their weight or in their presentation, we know how they look normally. And I think going back to what you said, the importance of continuity of care, because then you establish a relationship with the patient. So when you know something is off skew, and so you're able to home in on that and kind of give them that personalized attention that they may need. So we can all do better. We can all be accountable. I think we all can put ourselves in our patients' shoes and be more empathetic. But I think if you lead in care that is really rooted and grounded in empathy, compassion, and thoughtfulness, and kindness, and respectful care, I think that we can be good partners with our patients and provide the best care for them.
Thank you so much. And that was a great way to kind of begin to segue into our wrap up. So I'm sharing some, thank you so much to our panelists. We're going to go back to thank you, but I'm sharing this mental health resource, maternal mental health resources. These, of course, are not all encompassing. If the panelists or the people that are participating have a wealth of knowledge and or know a resource that is not listed, please add that into the chat and we will make sure to capture that data and send it out. We will send it out to those that are on that did the survey that we've been posting consistently. So do the survey and then we can help to share this resource with you all. And so I'm going to leave this screen up as we just thank our panelists so much for all of the wonderful droplets of knowledge. And of course, this conversation could have continued to happen for the next week. And we're hopeful that this is only a glimpse of a conversation and not the end of it. We're so thankful for coming out, for you all for joining with us and sitting with us during this duration of time. And you all were awesome and amazing. So please be sure to follow up with Black Health if you have any additional information. We're so happy that you liked this. And do the survey. Do the survey. Open it up right now. If you can't do it right now, just put it on your screen. You might be able to get back to it later. We will also send a follow-up email. So here are some resources that are awesome. Some of them are national, some of them are local, some of them are community-based. And so we got a little bit of everything for everyone. Awesome. You may have some local resources depending on where you are. And so be sure to add those into the chat. So I'm going to leave this screen up, but thank you all, our participants and our Facebook Live peeps. We hope you stay connected and tune into the next one. And we talked a lot about mental health, Black mental health on a previous panel, so make sure you find that on the Black Health YouTube channel and or Facebook page. And so if you missed any questions, you may be able to do that and also tune in for next time. So thank you. Play some jazz music as y'all leave. Okay, there's still some people here. Ancient song is awesome.